Aside from the introduction of primary healthcare policy in the 1980s and the Nigerian National Health Insurance Scheme in 2005, Nigeria's healthcare policies seem to have remained static. The National Health Bill, which many believe could help streamline activities in the sector, is yet to be enacted, while universal health coverage in Nigeria is still very low at about 7% coverage of the entire population.
The primary healthcare system, for all practical purposes, is non-functional in most local government areas in the country. And in areas where there are some activities, there is gross underfunding. There are exceptions. Lagos State, Rivers State, Delta State, Federal Capital Territory, few states in the Southwest Zone, and a few states in the North Central zones.
Perhaps owing to efforts of these states, maternal and child mortality rates have decreased between 2008 to 2012, and that's going by the 2012 Millennium Development Goals report. Also, the total number of wild polio cases as at September 2014 stand at 6, against 47 at the same period in 2013.
Life expectancy average between men and women was 47 years. But today, the average is 54. The maternal mortality ratio average was 545 per 100,000. Today, it is 350, still high. But 545 is not the same thing as 350. You take under 5 mortality ratio, the figure was 157 per 1,000. Very high. We are still high, but we have gotten below 100 as average. Today, as I speak, it's 94. Some progress.
But the country still has a long way to go to achieve the Millennium Development Goals, which have to do with reducing child mortality by 2/3, reducing maternal deaths by 3/4, and combating HIV/AIDS, malaria, and other diseases. The incessant strikes in the health sector have not helped matters. Medical doctors and other healthcare professionals in public hospitals have locked horns with themselves and even the government at the expense of the patients, who by force or by choice have to seek alternative medical care in and outside the country.
Government still forms a bulk of the employment in the healthcare sector, and that is why this happens. So if the government begins to think about ways of divesting and improving public PPP relationships, where you are going to get people who will come and run place professionally, one, those people will create services conditions that will be acceptable to a lot of healthcare professionals, but two, they will hold them accountable to.
The Ebola virus disease incident also tested the country's public health emergency capacities. Although 7 people, including the index case, were lost to the disease, 12 people survived the virus following intense supportive treatment.
We at First Consultant Medical Center took a risk. We sacrificed our lives because we knew that we wanted to ensure the safety of Lagosians, Nigerians, and humanity.
We must give kudos to the Federal Ministry of Health and the component elements at state level. I believe that if we continue to handle a whole range of endeavors that way, then of course we might begin to have interesting times.
Healthcare delivery system in many developed and some developing countries now has as focal points safety, effectiveness, patient-centered care, timeliness, efficiency, and equity. For Nigeria's healthcare system to get to that stage, a strong political commitment, adequate funding, and a well-coordinated healthcare team would form the ladder. Yomi Otaigbe reporting for Channels Television News.
Well, chronicling some of the issues there in our healthcare. Well, you also have highlighted some of those key indicators with respect to achieving the Millennium Development Goals. Well, how comparable are some of the figures here with the ones you also have seen in the field?
Okay. This is where I always try to draw attention to the necessity in disaggregating the health and general development indicators. What you've seen in most of the statistics drilled out here are the averages in the Nigerian indicator. It doesn't tell us, for example, the difference between a Bauchi and an Enugu, or even if you can't disaggregate them on purely state matters, why not on regional basis? So when we do that, it helps us to target exactly where the problem, because if we have, for example, an indicator that is struggling on the Nigerian scale, how do you attack it if you don't know where exactly it's coming from? Because what you have is an average. Something that draws the average down and something that draws it up. It's possible that the place where it's being drawn up could share lessons with the other place, and then so for me, that's the kind of improvement I see that can be made in that light. Otherwise, that was a rich report, and it said a lot. It started with issues, or it mentioned issues like even our perception of what is a health delivery system. Health delivery system. The health delivery system, apparently it appears to me that one of the major challenges is that we haven't been operating it like a system. If it's systemic, then the parts that are working within the system will be integrated and integrating with each other. But today when you have doctors asking for their agenda and pharmacists asking for their own, and all these people are components of the same health delivery system, I have never seen one day that one of them will agitate on behalf of all of them. Yes, maybe that's a bit too much of a hasty statement. But what I see is that it's a system where the elements are not combining; they are not working in synergy. They're not working in rhythm.
The recently passed health bill, national. Do you see it helping in ensuring that so many things as a standard, basics? To measure
yes, it does. It improves on the indicators, it improves on the enabling environment, but it will not make a doctor see the hospital cleaner as his partner. That will not do that.
The indicators mentioned in that report are some of the indicators that international donor agencies are usually quite interested in, and especially in bringing down. What role do you see a role for them here, and how usually do they get involved?
No, you see, indicators are results. If you say maternal mortality, you want to reduce maternal mortality by 30%. That in itself is a result. That means you must have a figure. Maybe maternal mortality is 500, 800 per thousand, or is 400 per thousand.
In our case, it's down to 300.
It's down to 300. Oh, the whole idea is that ideally we should have it under less than 5% as possible. So we want to continue to work at something, toward meeting a certain result. So there are activities and projects and programs that you can do that will help to drive that, like increasing the number of trained nurses, like increasing you have maternal mortality as a result of loss of power in some hospitals. You have maternal mortality as a result of inadequate staff, of not having anesthesiologists there. You have it as a result of maybe nurses are on strike. You may have it as a result of simply because the regulatory authority to look into the sanitation of the particular hospital did not do its work well. And so, instead of having a baby and coming out safe, you're going to have and carry the bacteria or whatever. So that's why we say it's a health delivery system. It has to be systemic.
Well, but in a case where it is as complex as that, how do international development agencies fit into that equation?
Well, we provide, for example, DFID provides support through our Part4 program. That's the Partnership for Transforming Health Systems, which is a policy-oriented health system, which looks at the policies in how the management of health delivery systems, particularly including the way to look at some of these issues that we're tracking. We look at things like how access to drugs, the revolving fund. But the target is really the primary health centers. Once you ensure that the primary health centers are equipped, that's what you can do as a minimum baseline.
The specialists, after all, they say in health, prevention is better than cure. Once you get the first aid, a lot of people who I mean, look, ordinary respiration, the first aid thing, first response for anything, can save thousands of lives in the US and all these places every day. Why can't we do the same for our people? Ordinary having a place to go to within 5 kilometers and not having to think because you don't have the money to pay, some having some health insurance scheme or some back support for a lot of people, that in itself can do. But the government is doing, I think what needs to be done is that, you see, we have to take health out of politics and take politics out of health. I'll tell you, I'm pretty old enough to know when the hospitals were working very, very efficiently. And I can tell you that before 1977, that was the case in Nigeria. I think what did it was, before the hospitals used to be run by professional health facility managers. Then there was a transition. They started being run by medical doctors. But the truth of the matter is, as a medical doctor, I don't do financial management. I don't do logistics in school as a training, which are the things that you need to manage a hospital and a health facility. Apart from, you need to know that there are clinical services. The main service is the clinical service. But the clinical services has to be run with the ambulance services. And ambulances are not driven by doctors, they are driven by drivers. And what you drive in an ambulance is a car that needs a mechanic. Right? And the doctor needs also the nurse and anesthesiologist, a physiotherapist, a pharmacist, a hospital records person that will keep the records, and we don't flip-flop records of people, that we can manage all these things. And you need all that. And you even need the air conditions to work and the lights to work. And all these people are part of the health service delivery system. As long as we get it that the hospital was made for the people, the patients. It's not for the doctors. It's not for the nurses. It's not for the hospital cleaners.
All right. A good place to leave it. Thank you very much indeed for coming.
It's a pleasure.
Sina Fagbenro-Byron is Regional Coordinator, Department for International Development, DFID. We're back after this break. Don't go away.
Thank you very much.